of any race, creed, color, religion, nationality, or otherwise. I don't know of anyone else who is scheduling marches. I don't. Maybe Black Lives Matter. I have no idea what they're doing, blocking highways or something. But the LGBTQ community has some marches coming up. That's why we're talking about this. Their fight is not over because the numbers. Now, when I talk to you guys about the numbers here in just a couple of minutes, it's going to make you think. And some of you are going to understand what I'm saying, and you're going to shake your head and think, wow, we really do need to come up with something. So, in talking to Heath about this, he told me that, the one thing that, the LGBTQ community is concerned about is the way Trump Care or the American Health Care Act, the way that it's going to be implemented. The way people with pre-existing conditions are going to be treated. Now, there is a provision in the American Health Care Act that does say that people who are already on Medicare, Medicaid, Social Security, disability for conditions that they have, they will not be excluded. But here's the problem, people. Think about this. Let's say we've got all these people with all these issues and they're covered because they've already had them. They're already receiving assistance. So the American Health Care Act is going to provide assistance to those people. But let's say 5 days after the American Health Care Act is passed, signed into law, and becomes effective, let's say the day after or a couple days after, let's say another 5 million people are diagnosed with HIV or AIDS. What type of coverage do they get? Think about that. That's the problem we're facing. The reason why we're talking about it with the LGBTQ community is for these reasons right here. And I'm going to read you something from the Human Rights Campaign. I also did a lot of research on the other side of the fence after I talked to Heath, and I thought, man, I dig a little bit deeper. I've got to have something to speak on here. So here's an overview from the Human Rights Campaign on hrc.org. And I'm going to read it to you verbatim. HIV continues to be a major public health crisis both in the United States and around the world. While major specific advances have made it easier than ever to prevent and treat HIV, there remains no vaccine or cure, and tens of thousands of people continue to contract HIV every year. Insufficient funding for public health programs, ideological opposition to common sense prevention policies, and societal barriers like stigma and discrimination have made it especially difficult for us to turn the tide against the epidemic. Together, the Human Rights Campaign and the Human Rights Campaign Foundation are committed to working with friends, partners, members, and supporters to end the dual epidemics of HIV and HIV-related stigma. Now, here's the twist on this. HIV disproportionately impacts segments of the LGBTQ community. And that's why they still march. That's why these marches are being organized. Yes, they've got their marriage equality. That's not what this is about. So many Americans, just like myself, before I did a little research on this, before I talked to Heath on the phone, so many Americans don't understand why they still march. This is why, people. Because we've got policies, we've got this health care in America that could pass the Senate. If it does pass the Senate, it's going to go straight to the president's desk, and he's going to sign it. So this is what we have to be worried about before this gets signed into law. According to the U.S. Centers for Disease Control and Prevention, the CDC, there are 1.2 million people living with HIV in the United States. 1.2 million people. And approximately 40,000 people were diagnosed with HIV in 2015 alone. So we don't have numbers for 2017 yet. Last year aside, I don't know what the numbers are for 2016. But just in 2015 alone, 2 years ago, less than 2 years ago, if you're going to talk about the full year, 40,000 people were diagnosed with HIV. While the annual number of new diagnoses fell by 19% between 2005 and 2014, progress has been uneven. For example, now this is where we get into the LGBTQ community. For example, gay and bisexual men made up an estimated 2% of the U.S. population. I'm going to stop right there. So think about 300 plus million people in the United States of America. 2%, just 2% of the 300 plus million people in this country are gay or bisexual men, or gay and bisexual men, combined. 2%. Now, in 2013, 55% of all HIV cases in the United States were among that 2%. Now, if you didn't catch that, let me rewind. This, what we're talking about, the gay and bisexual men made up an estimated 2% of the U.S. population, but they make up 55% of HIV cases in the United States. That's a lot of people. So this is why the LGBTQ community still marches, because they're worried about health care. If all these people are afflicted with HIV or AIDS right now, I can tell you guys, not everybody's covered. I may have talked to one person who is covered, who it may not even be covered all that well if you think about it. But he receives assistance for his medication, and that's wonderful. But this is what we got to worry about, guys. We got to worry about pre-existing conditions. We have to worry about people right now who have absolutely no health coverage because they're young, because they're healthy. They have no health care. They don't pay for health insurance. And then what if they receive a diagnosis like this? Well, then what happens to them? So just from speaking to Heath, the LGBTQ community is genuinely worried about life or death. How many people will die if we don't cover them? Now, a lot of you conservatives, I'm conservative, but I have an open mind. A lot of conservatives are going to say, well, it's not our job to pay for people's mistakes. Well, let me tell you something. Nobody wakes up in the morning and trips and falls into a puddle of HIV, okay? That's not how this happens. There's a lot of ways people contract HIV or AIDS, and it's not just gay and bisexual men. It's not just women. It's not just straight men. It's anybody. This could happen to anybody. But we don't need to penalize people for having a disease. It's the same thing with cancer. Same thing with lupus. Same thing with multiple sclerosis. Anything that people can be afflicted with, we don't need to discriminate. And the reason why the LGBTQ community is still marching, the reason why they have a problem with this is because so many of them are affected. And I asked Heath point blank, I said, Heath, look, I'm ignorant to this too because I'm not part of that community, so I don't know. But how big of a problem is HIV and AIDS within the LGBTQ world? And he said, man, it's huge. It is a huge problem. Now, does that mean that these people are irresponsible? No. Everybody's irresponsible at times. I'm sure that we can look back on things that we've done and we can say, holy crap. I'm glad I'm not part of the statistics right now. But not everybody can do that. Not everybody can pat themselves on the back and say, hey, well, we came out clean on that one. Not everybody can say that. So that's where the problem is. And we've got to worry about if these numbers are going to go up and go up and go up. Yes, they did fall by 19% between 2005 and 2014. But we all know that things get worse. That's the way the world works. Things are always going to get worse. If going back to this article, if current diagnosis rates continue, 1 in 6 gay and bisexual men will be diagnosed with HIV in their lifetime. For Latino and black men, now this is just a study that's been done. For Latino and black men who are gay and bisexual, the rates are 1 in 4 and 1 in 2. Think about that, folks. 1 in 4 gay or bisexual Latinos will be diagnosed with HIV. 1 in 2, that's half, 50% of gay or bisexual black men will also be diagnosed with HIV in their lifetime. That's a huge number. That's why they're still organizing these marches. The fight's not over. It's turned to health care. Marriage equality? Great. We got it. That's over with. But now we've got to worry about health care, because I can assure you right now, just from talking to people, they do not want to see their own people die at the hands of the government. You tracking? And that's who controls life or death for these people who have these issues. Same thing if I had this. I mean, I'm worried about it right now because it affects my friends. I'm not going to sit back and say, well, it doesn't bother me right now, so I'm not going to worry about it. That's stupid. That is ignorance at its finest. So it's my job to bring this stuff to the forefront, and I'm very lucky that I have a platform to do this on. The Filling the Void Podcast Network is very, very supportive of this show. I don't think, honestly, I don't think everybody agrees with me all the time, but they're very, very supportive of what I bring to the table, and that's because these are real issues. Now, we have guys who do shows about movies. We have people who do shows about video games. We have people who do shows about TV. And that's great. Hey, and they do a great job. I can promise you. I've listened to their shows. What I want to bring to the table is not entertainment related. This is life or death. These are issues that we face in the United States of America, and we, the people, in order to form a more perfect union, have got to take a stand for the person sitting next to us. It doesn't matter if you're Latino or black or white or Asian or Native American. It doesn't matter if you're gay, straight, bisexual, transgender. It doesn't matter. We have all got to learn to live together. That's where we're at in the United States of America. It's a different time. It's a different place. And you can't say, well, I grew up thinking, guys, it doesn't matter how you grew up. If you grew up discriminating against anyone for any reason that is different than your own, that's discrimination. And it's fine. That's the worst of it. And that's not how we do business in the United States anymore. Going on in here, it says transgender people have also been hit especially hard by the epidemic, despite comprising a similarly small percentage of the U.S. population. While better data is needed to understand the full impact of HIV on the transgender community, one international analysis found that transgender women in certain communities have 49 times the odds of living with HIV than the general population. 49 times the odds of living with HIV as opposed to the general population. That is a ton of people. This is why they still march. So for the article that I referred to at the first of this, to say that the LGBTQ marches have no basis in reality, I mean, first of all, that's stupid. That is stupid. Second of all, that means that people are not doing their research. They are not educated about issues in the United States of America. And the biggest problem with that means they don't care. If you're going to write off an entire community of people who make up 55% of HIV cases in the United States, if you're going to write them off because you don't understand and you don't want to understand, you have a problem. The problem is not with the people who are afflicted with this. The problem is not the people who fight and scratch and claw for health care and for help with medications so that they can stay alive. They're not the one with the problem. You are. If you discriminate against these people, You have